This is Ty Newell with COVID status report number 30, super spreaders and shedders and the pigpen effect, posted November 15th, 2020. Infections are screaming at record rates in Illinois. This pandemic's nowhere near being stopped, and yet people still just don't understand. They just don't believe. Here's a local school that's advertising for their dip off. When I dip, you dip, we dip, and we all get COVID. Incredible. Please, please don't go to things like this. Save yourself. Current infections continue screaming off the map. More than 11 million infections in the US, more than 250,000 deaths. This preventable disaster, and we're still getting encouraged to ignore it by Blotus and LeBlotus. The biggest liar of the US and the lying advisor to the biggest liar of the US. I don't know why they want us to die, but that is what they're doing. They're killing us. We've got about a 2-month window. We need to protect ourselves. And great news is that a much needed vaccine with 90% reported effectiveness may be available coming in the spring. I was doubtful that one would make it past 50% effectiveness, so I'm very encouraged by this news. But at the same time, we've got 2 months of the government continually spreading falsehoods, continually encouraging us to ignore this. We don't have to shut down. About a 15% reduction of social interaction, that is how much you go out, and about a 27% decrease in transmission efficiency. That is just getting that many more people to wear face masks, to improve ventilation, to improve the filtration, to stay 6 feet apart, or a combination of those two will get us back to a level where this infection parameter is below 2.72, where infections will decay instead of accelerated growth. But as I show on this infection parameter chart, remember infection parameter is a ratio of the number of people infected over a 2-week period by an infectious person. Since LeBlotus started in mid-August, we're just continually going up. Here's how it spreads, and that's what I wanted to concentrate on, is the mechanisms and why it's confusing, why it's difficult to understand, why it's just sometimes a person can be with someone that has COVID and not catch it, and other times lots of people do. But let's say you're having a dip off, okay? A lot of people come, you have an outbreak. Now, an outbreak, the definition is roughly 2 or more people that are infected by an infectious person. But here's the thing, as reported in the literature, as they've studied these and tracked these around the world, about 20% of outbreaks occur in public gatherings. So a relatively small fraction compared to about 80% that happen in the home. But those 20%, somebody goes to a dip off, they're infectious. They infect maybe 8 to 10 people, and then they go home and infect everyone in the home. This gray dot is someone old like me, someone old and decrepit, who, if we get it, we really get it. And so as you think about, well, my First Amendment right, I can do whatever I want, well, yeah, you can, but other people are going to suffer for your irresponsibility. Now, what happens is that not everybody that's infected is going to spread it as easily. There's some among us who are super spreaders and shedders, but we can't tell who that is. So I wanted to talk about that a little bit. And now I wanted to tell you a little bit more about this airborne nature of the disease, something I've been telling you about since March. And finally, others caught up and said, yeah, airborne's important. Airborne's different than the cough, sneeze, loud talking, and stuff like that. Cough, sneeze is your upper throat, your trachea up through your mouth and other regions, your bronchial tubes, but a jet of air comes off, shears that film out, relatively big droplets, 2, 5, 10 micron come out, and they shoot out. And if you're within about 6 feet or even 20 feet or more, because a cloud of these things can stay together and move further, that you want to be protected from that. But that's what a face mask does. It will catch this stuff coming up out with a cough and a sneeze. But the stuff that comes from deep in your lungs, the zero 0.5 micron and less, a human hair, if I had some, I'm kind of in limbo here as I'm waiting to make sure Blotus really does leave and we can get on track. But a human hair is about 100 microns. So 0.5 micron is pretty tiny. And most of the respiratory droplets, 80% of them are in this range. And not all of us put those out. This is just normal breathing. It's coming out of your nose, coming out of your mouth. It's not something like that. It's coming out while I'm just breathing. But here's the thing. Only 50% of us put out those small droplets. 50% don't. And we can't tell who among us puts out the droplets. And then among that 50%, half of them are responsible for 80% of the respiratory droplets. So this is an internal inherent characteristic of your lungs. It doesn't matter if you're sick or not. Okay? Whether or not you're putting out respiratory droplets is independent of if you happen to be sick or not. It's just characteristic of what's happening with those little air sacs down in your lungs and how they may expand and contract and form some of these little tiny droplets, and they come out. And when they come out, if you're sick, then you may also shed. But it's not always the case that you're shedding virus, even if you're sick. So you got couple of things going on. First, about 50% of us in just normal breathing put out these very tiny droplets. About 25% of us put out 80% of those droplets. Okay. So so chances are good that you're in a crowd that 3/4 of them aren't putting out many droplets, but you get one of these people, perhaps me, perhaps you, that has this characteristic of putting out a lot of these droplets, and you can't see them. You can't see that size. That's tiny, tiny. That's smaller than a bacteria. It's a very tiny thing. It's not smaller than a virus. So you put those out, and then the other side of it, are you a shedder or not? Not all of us shed virus. Not all of us have the virus deep down inside to be shed out with airborne particles. That's why it's so difficult to see that airborne is a very, very important mechanism. But you get a super spreader and shedder, someone that puts out a lot of droplets as well as is shedding into those little teeny tiny droplets, you've got a rose garden party. Okay, you've got problems. Lots of people, like a wedding party, a dipping party, or other, lots of people are going to get sick. And unfortunately, the masks that we have today don't protect us from that. We should have masks now, N95 masks that protect us, but somebody hasn't been on the ball getting those produced and distributed and given to everybody. So we could clamp down on this transmission efficiency, get us back to the decaying region and snuff this damn thing out. Okay. I want to tell you about an experiment we ran a few weeks ago at a local jazz venue. It's getting cold outside. This performance over on the left that I went to with one of my favorite saxophonists, Professor Chip McNeil, director of the jazz program at the University of Illinois. It was 45 degrees out. At least our beer wasn't getting warm, but it was getting cold. We want to be inside to enjoy performances like this. And so we ran a special experiment because the University of Illinois, with its extensive testing program, we test twice a week, that we could ensure that we could put together a COVID-free group of people. So we had 2 student jazz ensembles play in the Iron Post. We had environmental engineering graduate students and faculty who gave their time and loaned their instruments for collecting data to look for these very fine particulates, and then to run tests to see if bringing in fresh air and doing extra filtration would help remove them, reduce the amount of contagion in there. But of course, we were contagion free because we were all tested. And so this group was a safe group to run this test. And we wore masks while we were in there, and we had table space apart and only 4 people per table. So we were following the guidelines that were allowed at that time. Of course, right now we're all shut down except for dipping parties in Illinois and many other states around the country because of this bad information Blotus and LeBlotus are putting out. So what happened? Well, there's a pig pen effect. Most likely you haven't heard of it, but each of us has our own personal cloud of pollutants and particulates. And as we walk in a room, these little tiny particulates, not all of them are respiratory, there's lots of other things, probably actually the minor fraction, even if you are someone that puts them out with your breathing, that these are a minor fraction. So the particulates that we monitored are actually kind of a tracer, but here's what happened. When we went in, the performance was starting at 3 in the afternoon. And so this is the particulate level. This is for 0.3 micron. We measured 0.3, 0.4, 0.5, and on up to 10 micron size particles. But it takes very sensitive instruments to do this. And below 0.5 microns is what we were especially interested in. So as the number of people, these stars went up to about 20 to 25 people. And just before the performance started, so the performance started at 3 with one of the jazz ensembles. You can see CO2 went up, these 2 blue lines, the dash and the solid. We had 2 different stations for monitoring CO2. Here we're looking at the mass of particulates, which is very low. It was at a level of about, say, less than 5 micrograms per cubic meter. Very tiny amount, very good, healthy amount. And then this red line are the number of particulates per cubic centimeter at 0.3. And we have several of these plots for the different sizes, but this one's of a special interest. You can see that these particulates went up to 8,000 of them per cubic centimeter. A little tiny amount, there's 8,000 of them in it. And that's not a lot, okay? It sounds like a lot, but that's actually pretty clean air. And that went up as the number of people went in, just like CO2. Now, this band here, we didn't have fresh air blowing in, but then we started fresh air, and you can see the CO2 went down as we diluted the carbon dioxide from our respiration with outdoor air. And you can see the particulates dropped. And then we turned the fresh air fan off, and we turned on a fan that had a filter attached, a MER 13 filter. Now what you see is the CO2 starts going up because we're not bringing in enough fresh air to hold it down. But the particulates keep going down because we are circulating that air through a filter that's capable of pulling out these tiny particulates that are the ones that can come from deep in your lungs, that can have virus on it and make you sick from airborne. And then we put on the fan, the fresh air fan, along with the filter, and we drop particulates down to a base level. So that's how you manage particulates. Now, incidentally, with about 8,000 particulates per cubic centimeter, you're inhaling about 64 million per minute. Isn't that incredible? And again, that's not a very heavy particulate loading, but you're breathing in about 64 million per minute. And the amount of mass, if you were to figure it out, it's about a microgram. per minute inhaled. And there's about 1,000 of those in a milligram. Well, there are 1,000 in a milligram. And an aspirin is 100 milligrams. So if you take 1,000th of 100th of an aspirin, that's roughly what you're breathing in a minute of these particulates. And then some level of them might have enough virus, if there's an infectious person shedding, to make you sick. Okay. So you want 40 cubic feet per minute of air per person, about double what standard ventilation is. But you don't figure that out by measuring airflow. You figure that out by looking at carbon dioxide, and that means that should be maintained at about 800. We could let this go up higher so we could get nice measurable results, because we knew everyone in there had negative COVID tests. So it was a safe environment to do this experiment. And these levels are not out of the ordinary. This is normal ventilation level. And I guarantee you 2,000 to 3,000 is typically what you might find in places that you're regularly visiting. You can't smell air at that level. It smells fine. Okay? But fresh air dilutes contagion that are laden with these small, tiny droplets. And then recirculating through a filter removes more of them, and you want the combination of them. 800 parts per million of CO2 indicates enough fresh air, and then recirculate at about 15 to 20 cubic feet per minute per person. The way you know that, when you buy a room filter, a recirculating filter, that it will tell you this one that you get at whatever big box store has 200 cubic feet per minute. This one has 300 cubic feet per minute with a MERV 13, MERV 16 HEPA filter. So you want that level of filtration. So stop the spread. I don't know why Blotus and Leblotus are telling, for example, Michigan, quit listening to your governor, go out and do the things you want. They're killing you. Michigan, they're absolutely killing you. They're, for whatever reason they want to foment dissent like that, I don't know, but don't listen to them. You're on a good path now as we go into November, and I was hoping this would be the worst path in my predictions, but you're going to cross it, okay? And we're just at the beginning of this. I can't tell you the pain our communities are going to see throughout the U.S. because of this irresponsible action. Our hospitals are going to get overflooded. We're going to be unable to take care of those who are getting very, very sick. And we're going to have to pick and choose which of us get to live and which of us are going to die. We're not going to have 12 doctors and access to experimental medications to help us. We can do this, though. Don't listen to Blotus and Leblotus and their minions. We have to do this. We have to hang on. We have to go for at least 6 months through this where we're in control. 800 parts per million carbon dioxide, MERV 13 or greater filtration, face mask, distancing, and don't go to dipping parties.